this little instrument is jet plasma. It's a little robot that we put in here. You buy the robot, and out of this we get a cycle, which is 3 treatments. We can do every second day for you, or once in 10 days. We literally send 13,000 volts of plasma right into your subcutaneous tissue, where it irritates and stimulates collagen and elastin reformation. So it's quite incredible. It works epidermally and dermally, so the appearance of skin looks better. And you there, that if anything like that is a concern for you, your health of your skin with product use is so brilliant now that we can do more.
What's it called?
I started off with lamp probe. This is jet plasma.
Okay.
All right. We can do it décolleté, neck, hands, and face. All right. So that's a magic little baby. That.
It sounds like it.
It is. We can actually do a slight eye lift for you. Then, of course, in what you see there is all my peels, different modules for different outcomes that we need, and normally we incorporate those in the beginning and in between medical treatments, because they do more than home care, of course. In the right hands, they're very safe. You need to know what you're doing when you work with peels. The client must be compliant to what you need. Sunblock, of course, and a lot of them are not painful. People, when they hear the word peel, think it's going to be excessively painful, sheets of skin is going to come off. Is there one that we do? Yes, trichloroacetic acid, but that's meant for a very certain look that we want to change. Not often that we do that one, but the rest are easy, quickly over, and brilliant, beautiful skin.
And is it only older skin that you will do peels on?
No, good question. No, let's take a teenager who's got congested skin in her T-panel, which we often see, blackheads, pimples, whatever. That's usually caused by there's a genetic factor. They actually get it from the mum, the father, the oma, or the opa, but also hormones. So can we help them? Sure. First home care, then there's a specific peel. So imagine I do a peel for a teenager that's got pimples and blackheads, and she goes red, crack open, and sheets of skin comes off. She will kill me, or he. So it doesn't do that at all. You barely feel it when I do. It's a beta-hydroxysalicylic peel, which goes deeper into the pore, remove oil plugs, and get the sebaceous glands to actually not work so hard and calm down. Plus, it kills the propionic bacteria. Beautiful treatment.
Okay, so all peels are not chemical, or
what we use, all peels are chemicals.
Okay, but it's not acid, or because
it is acid. Okay, good question.
Please explain to me.
When someone here, okay, this is actually quite funny. So when the public hears acid, they think, oh, it's painful. It's not going to be good for my skin. Okay, so what's hyaluronic acid? Something the body produces.
Okay, a natural product.
So what we use in peels is either fruit acids, which we call alpha hydroxy acids, or beta hydroxy acids. They come from plants.
Okay.
So glycolic comes from sugarcane. Lactic comes from milk.
Yes.
That's why Cleopatra bathed in it. She was clever. It's a hydrator plus an exfoliator.
Wow.
So they're all exfoliating and then do more, depending on what the skin needs. Does that answer what you're
Yes,
what you're
because
asking?
I always had this acid burning thing in my head of a peel.
Yes, absolutely. Are some of them more, can you feel them more? Yeah, sure. We've got a Beta Peel. The Beta Peel Plus is for oily skins, which really you don't know that I've done it. It's not painful, you're not red when you leave, your skin's just so much fresher and better. But then we've got a Beta Peel. Now, Beta Peel is for someone who's got pigmentation and who wants, to get the skin to be healthy, glowing, and younger. That one is very different to the rest. It's got a heat component, AD. So when you apply it, I always tell my clients it will go up from 1 to 10. Then it starts self-neutralizing. I can't neutralize it. So we have self-neutralizing and ones that I, as a therapist, have to do. That actually goes down to 0. We do a second layer, it goes up very quickly, down very quickly. And yes, it's not, once it's over, it's over. And with that, you can flake visibly or not. But sheets of skin is very specific for a specific skin. Reason why you do it is very, very sun damaged skin. You want to actually peel layers of skin off, and then of course, you know, you get the results. And sometimes it actually needs 2 treatments to actually achieve that look.
Okay, so you don't always peel
No.
after. Okay.
No,
So,
no, you don't. The one for the teenagers, the Better Peel Plus, no peeling, no microflaking.
because you think that with the word
exactly,
peel.
you do. And lactic acid peels, there's a 30% and a 90, or lactic acid 90 or 30%. 30% is when you start off, you're not on active, we can do that one. It's very much hydrating, but exfoliating as well.
Okay.
And 90, the 90-10 is really, we call it a lunch hour peel, which means you come in, we do you, and you go back to work and no one will know you've had it. Your skin just is so alive and well hydrated. And
Yeah, that is very
repeat. You can
interesting.
repeat that every 2 weeks, once a month. Yeah, it's not always a hectic thing, a peel. Really, people do think it is and it isn't.